As I mentioned, Jackie's third goal, of course, was learning to manage negative self-judgments as well as self-talk that contributed to self-loathing. Over our time working together, she began to find that 3 DBT skills were really vital for her to use to manage the patterns that led her to self-hatred and abasement. First, her using mindfulness allowed her to build awareness of when she was beginning to engage in the negative or ineffective self-judgments. After she had built awareness of when those judgments were occurring, she then came to manage those thinking patterns by using 2 distress tolerance skills in particular. The first being the grounding skill, and the second being the distraction skill. So after noticing a judgment, she would attempt to use different grounding or distracting exercises to help her shift her attention away from her thoughts and into her body or her environment. Now, I'll mention 3 of the grounding exercises that Jackie found helpful at various times in our work together. First, I taught Jackie the 5-4-3-2-1 grounding exercise. This grounding technique is a great combination of several of the mindfulness skills, playing primarily on the observe, describe, one mindfulness, and effectiveness skills. This technique asks Jackie to bring her attention to observing her 5 senses and describe things in her environment in the present moment and redirect her attention away from her thoughts when she noticed her attention drifting back to her judgments and ruminations. So Jackie would start with observing and describing 5 things she saw in her environment in full detail. Then she would move on to describing 4 things that she heard, 3 things that she sensed or felt, 2 things that she smelled, and 1 thing that she tasted. Jackie would then watch when her mind wandered back to her judgments and just attempt to call her attention back to the things she was previously noticing. Jackie even took initiative to at one point pair this exercise with her square breathing techniques. So she would breathe in for 4, and when she was holding her breath for 4 seconds, she would describe to herself whatever she observed, then breathe out for 4 seconds. This added just another layer to the exercise that forced her to focus on her observations and her breath and pulled her attention off of her thought processes. Another grounding exercise that Jackie found helpful was one I called Colors of the Rainbow. This is similar to the 5-4-3-2-1 exercise in that she was asked to observe her surroundings, but this time she would find every item in her environment that corresponded with a certain color of the rainbow. So if you remember your 8th grade science class, the colors of the rainbow are Roy G. Biv. That's the acronym for it. Red, orange, yellow, green, blue, indigo, and violet. Jackie would start with red and find all of the items in her environment that were red, then move on to the other colors. This also worked on that same mechanism in that it allowed her to push her mind's attention into something more effective than engaging in those judgments that caused distress. Now, the final grounding exercise she found beneficial at times was one I called feet pressure. This one is dialectically both easy and tricky simultaneously. In session, I taught Jackie to push her feet into the floor as hard as she could to notice the various sensations she felt. I encouraged her to pay attention to different parts of her feet and legs, even down to her individual toes, and what those different parts of her body were feeling. She found this beneficial because it forced her to move her attention away from her ineffective thinking patterns and into her bodily sensations. On days when her knee pain was pretty intense, we changed this exercise up too, where she would clench her fists instead, or run her fingernails over her forearms to work off the same principle of making bodily sensations override her attention. Now, grounding was helpful for her, but if grounding didn't work in the moment, Jackie would then attempt to engage in behaviors that allowed her to distract herself using both her mind and body. Again, the idea being that she was trying to override her attention as much as possible. So things that could pair both mental activity with physical activity were really beneficial for her. Activities like going for a short walk, painting, cleaning, or baking allowed her to move her body and get her mind off of her thinking. They were immensely beneficial to Jackie when her mind would start racing with negative self-talk. And finally, in our conversation, we come to addressing Jackie's 4th treatment plan goal with distress tolerance skills. Now, to revisit it, her 4th goal was related to improving communication with others. And Jackie worked hard to build her boundary setting and assertiveness goals. However, changing her relationship communication dynamics brought significant distress for Jackie, as it would for many of us. Boundary setting and assertiveness was completely foreign to Jackie. She remarked that it was often more comfortable for her to continue receiving derision from her mother and continue her caretaking patterns rather than change them, just due to the stress she would incur by adapting those dynamics. The distress tolerance skills were vital to Jackie in managing her distress and concerns about the conflict in her relationships. Specifically, she benefited from grounding techniques to get her attention off of her rumination, as well as to look at how she could create meaning out of her distress about changing her patterns. And self-soothe was an important skill for her to use in this module as well to help manage the stress that came with changing those dynamics. When Jackie was experiencing high distress about setting a boundary with her mother around her mother judging her weight, she was able to create her own at-home day spa, as she called it, in which she soothed herself by taking a bath, playing relaxing music, dimming the lights, and drinking her favorite type of tea. Jackie found this self-soothing to be so helpful. We once actually spent a large amount of time in one session building a list of other ways she could self-soothe to manage her distress too. And of course, as we think about interpersonal effectiveness, the radical acceptance skill was really important for Jackie to practice and foster as she was working to change these dynamics. She was not able to control the other people in her life, in particular her mother. And so she had to find a way to balance her change strategies of setting boundaries and practicing assertiveness with acceptance in that she may not be able to change her mother's behavior and judgments.